signed, you know, so that's why I moved it back. All right. You hear me at all? Check, 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 check. Channel 2. 2, 2, 2, 2. Did you get all your sound checks you needed? Okay. All right. Actually, I had the audio half down. Anthony, can you bring the house up? Check, check, 1, 2, test, test. Testing, 1, 2, check, 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 1, 2, 3. All right, we're good. Test, 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 test. Check, 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 check. Channel 2. Check, 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 check.
You got Eureka's mask on. Thank you for joining me today for today's daily COVID-19 update. I'm joined by a whole host of luminaries to make some comments today. We have, of course, Dr. Jose Romero of the Department of Health. We also are joined today by Gina Wendell of the Chief of Staff of the Department of Education, and then Troy Wells, CEO of Baptist Health System, important part of our announcement today, and then Stuart Walton, who just finished a meeting with our Economic Recovery Task Force, will also give a brief report on the work of that task force, which we greatly appreciate. If you recall 6 months ago when this pandemic started, that the Department of Health had one testing machine that could do 20 tests per day. That's all it could do. Since then, we've built the capacity where now we can do over 3,000 tests in a day in our public health laboratory. This is incredible growth in capacity. And what I've said probably a month ago when we started having serious issues with our commercial labs and their production and their reliability on the test, that we needed to control our own destiny. And that's for that reason we have invested in antigen testing equipment, but we've also expanded our capacity and partnerships in terms of our own PCR testing within our Department of Health. And so today, as part of controlling our own destiny, I'm pleased to announce the Department of Health's partnership with Baptist Health in order to increase our testing capacity by 20%. And this again will add to our ability to make sure we can do adequate testing here in the state of Arkansas. The Department of Health under this partnership will refer 50% of the tests that come in over to Baptist Health for their analysis, and Baptist Health will provide the personnel to operate the Thermo Fisher machine in which the Department of Health is providing to Baptist. Baptist Health will be operating this machine 24 hours per day, 7 days a week, which is a very significant commitment and again an expansion of our testing capacity here in Arkansas. So thank you, Baptist Health, and Troy Wells will be making comments on that a little bit later. Let's go to our cases. The last 24 hours we've seen an additional 385 in positive PCR tests. That brings us to 66,406. In terms of hospitalizations, we've had 2 additional Arkansans hospitalized. That brings us to 411. And we've had 11 additional deaths. That brings our total to 928. In terms of testing, we've tested 5,208 tests, which is a good, strong testing day with our PCR tests over the last 24 hours. In terms of our antigen tests, we've tested 699. That gives us 114 positive. That gives us a positivity rate of 15.4% for our antigen test. Now, for those sharp observers, you'll say, well, if we're considering the antigen test positives as real cases, then they ought to be added into the total. Well, we'll continue to report those according to CDC guidelines separately, but it is informative to see them combined. And so if you add the 385 positive cases under the PCR test with the 114 of the antigen test, that really gives us 499 positive cases within the last 24 hours. I know that is an extra step to go through to get that total, but that allows us to report separately to the CDC, but also to be transparent with the people of Arkansas. Let's go to our graphs. Here you can see that we're obviously way down from our last Friday's high number. In fact, we've been down consistently since then at that less than 400 level for our PCR test. And the next you'll see the 7-day rolling average that again has us away from the peak, and we're flat right now. Hopefully we'll continue or go down, and with the numbers that we see today, hopefully that will be the case to go down. The number of hospitalized is remaining really steady. Some days it goes down, but we're way below where we were at our peak, which shows we have good hospital capacity. And then the number of active cases is down. That'll go up and down, but we're way below where we have been at the peak again. And then the 7-day rolling average of positivity. And again, I sort of disregard the last couple of columns because they'll be backfilled in the coming days. But you can see we're well below the 10% level, and our positivity rate really is looking better, but on the margins. And so we've still got more work to do there. In terms of our antigen test, by date of result, it just shows that over the month we've now done 4,000 antigen tests. And again, we just did 699 over the last 24 hours. And then this is the positive, this is the PCR test by type of facility. And this is important because you can see the Department of Health has a higher capacity. I said 3,000 it has an easy capacity for. We don't do that every day because the demand is not always there. A little bit unpredictable as to how the demand comes in, but our capacity is there. And then the red, of course, is the commercial labs, and we've seen their capacity well over 6,000 on some days in the past, and most recently their capacity, or their results, not necessarily their capacity, but what we're getting out of the commercial labs has been reduced, and we don't want to be simply relied upon that up and down, and that's why, again, this partnership with Baptist Health will be very helpful. Just to show cases per 100,000, everybody looks at, and obviously, whenever you look at the southern states, Louisiana, Mississippi, Alabama, Tennessee, and Texas, that we're going through an increase in cases, but our per 100,000 cases in Arkansas ranks right in the middle behind those that I just mentioned. Some are, and this will go up and down, but it shows we're right in the middle of those states that are analyzed. I believe that concludes those for now. And with that, let me ask Dr. Romero for his comments, and then I'll ask Troy Wells to make a comment on this partnership, and then I'll introduce Stuart Walton.
Thank you, Governor. So I will add a little bit more to the data. As mentioned, we had an increase of 2 individuals that were hospitalized for 411. We also had a decrease of 2 individuals requiring a ventilator, so we're down to 82, which gives us significantly reserve for ventilators. Our total deaths, as mentioned, were 928. That's a result of an increase of 12 deaths in the state. 7 of those deaths occurred in nursing homes, with 2 small clusters, one occurring in Beebe and the other in El Dorado. Recovered cases, we've added 660 to the rolls. We are now at 59,920 individuals. With regard to the top 5 counties, or top counties over 20 cases, we only have 5 today. First is Washington County with 42, followed by Craighead at 21, then Pulaski at 31, Benton at 24, and Jefferson at 23. So let me add my comments to those of the governor with regard to testing. I think our joint partnership with Baptist will expand our capacity significantly. I want to extol the efforts of the Public Health Laboratory and state that from September 2nd to September 8th, the lab performed over 19,000 tests, and that would rank the lab, the Public Health Laboratory, in the range of a commercial laboratory performing testing. So this extra capacity provided by Baptist will further increase this. And then lastly, I want to let everyone know that our new mandates for restaurants have been placed on our dashboard. This increases the options available to families and includes self-serve restaurant venues. And that can be read at our website. So I'll turn it back over to the governor.
Thank you, Governor Hutchinson, for having me here today for this really exciting announcement. I think we all recognize how important partnerships are, and in healthcare especially, and during times of pandemic especially. I think we've seen the state of Arkansas and the healthcare provider community work in partnership throughout the last 6 months or so. And I think today is just another great example of how we can use our collective resources to better serve the state of Arkansas. So I'm excited to be here and be a part of this. You know, this started several weeks back, this discussion of how we could partner together to help provide more testing. We've reached the agreement to do so, as you've heard today. The state's providing the equipment. Baptist Health is providing the technical professional resources to run that equipment 24/7, 7 days a week. This is commercially rated lab equipment, which means it can really run a large number of tests. This is beneficial for Baptist Health because today and over the last several months, we have sent anywhere from 400 to 1,000 tests out of state to a reference lab, and that turnaround time, as we've talked about and here many times before, has been rather slow at times. So it does benefit Baptist Health, but first and foremost, it will benefit the state of Arkansas and the Department of Health's commercial lab. So each day there'll be the first block of tests will be dedicated to the Department of Health, and then after that block of tests is used up, Baptist Health can utilize that machine to run its tests that we normally, like I said, would be sending out of state. So this piece of equipment runs over 1,000 tests a day, so this really will add some needed capacity to our in-state testing. The reagents for this machine, they're more readily available due to the partnership with the state of Arkansas, so it really has been beneficial for everyone. This equipment is on order, and we expect it to be here by October 1st and be operational. So we're really excited about this. I want to thank the governor once again, and the Department of Health, Dr. Romero and your team there who's worked so hard to make this happen, as well as the team at Baptist Health. So thank you, and Governor, back to you.
Thank you, Troy. That's really great news for us. And as everyone knows, the Economic Recovery Task Force has been meeting regularly, both in full committee and in their subcommittees, and their recommendations have been very instrumental in guiding our recovery, but we're not completed yet. We still have much more to do in terms of our economic recovery. Stuart Walton has led that effort, and I want to invite him to come and give some comments about their preliminary report.
Good afternoon, and thank you, Governor. We had a good meeting this morning with the Economic Recovery Task Force. We had about 20 people, I think, in person, in the flesh, socially distanced and all masked up. And in this meeting, we accomplished a couple things. One, we had a great update from Mervyn Jebaraj. He's an economist at the University of Arkansas, and he gave us some really good information on the state of the Arkansas economy. And I just wanted to kind of pull out a couple of extracts from Mervyn's analysis and work that I thought might be interesting. You know, two of the biggest drivers for Arkansas's economic activity in the last 6 months, and it's very clear when you start clicking into the data, are one, just the government stimulus, the activity from the federal government, whether it's the PPP loans, the unemployment boost and benefits, and the stimulus checks. There's just no question that's had a pretty material impact in Arkansas's economy. And then the other bit that shows up pretty consistently in the data is the elevated case numbers. And when case numbers are rising fast, you see a corresponding slowdown in certain areas of the economy. And so it just drives home the point that these crises are inextricably linked, the health crisis, the economic crisis, and that to solve one, we have to solve the other. A couple other data points from Mervin's report. One is, small businesses are taking it on the chin, and they're faring worse than larger businesses with more resources. And we just see, in particular, the leisure and hospitality segments, as well as in-store retail in the small business arena as being those particularly hardest hit. If you look at the hospitality and leisure numbers, we've got, just some pretty challenging conditions out there. And you hear it from restaurant owners, you hear it from like folks at event centers like the Walton Arts Center. Over 70% of Walton Arts Center patrons would be uncomfortable returning to a live performance today. Restaurants, they're trailing last year's revenue at about 35% below where they were last year, and that's just for the month of August. So it doesn't take too long to start reflecting on these numbers, thinking, hey, as good as the state of Arkansas is doing on a relative basis, we still have a long way to go. I want to talk briefly about, just the impact that some of these small businesses closing would have on the state, because as a patron of one of these restaurants, it would be disappointing to see it close. But as the proprietor of one of these restaurants, or as an employee of one of these restaurants that might close, it would be life-changing. And again, it drives home the point that we've got to solve this health crisis to move forward in our economic crisis and to overcome and move out of the situation that we're in. Making good progress, but a lot of work to go. Now, the task force has produced a progress report. It's in draft form, and we're going to get it to the governor, we hope, tomorrow. We're getting final comments from the rest of the task force members today and tomorrow. We've got just a summary here of the various headings within the report, and this report will be posted on arkansasready.com later this week when it's presented to the governor. Final point I want to make is just how much the task force unanimously supports the work of the Department of Health and the issuance of their guidelines. They are on the right track, and as a state, I know it's getting a little bit fatiguing to continue to operate in a way that feels so uncomfortable sometimes, but we just have to overcome that. We have to continue to put our confidence in the Department of Health, their leadership, and all work together to continue to make progress and move through this. Thank you, Governor.
Thank you, Stuart, and I look forward to the report that will be released later this week. With that, we're happy to take any questions.
So as far as the partnership with Baptist Health, does that mean, since only a portion of that equipment's use is going to be for the health department's test, does that indicate there's just not the demand for testing to have the health department machine used to its fullest capacity?
So, the Department of Health did not have the space for another machine. And so we had purchased this machine and hoping to have a partner for it. And so it's not a reflection of lack of demand and utilization fully of the Department of Health equipment. It's we needed a partner for space purposes as well as personnel. And so that's what Baptist Health is providing. And so that's the expansion of the capacity that we have in testing. You raise a good point, though, that while we might have a capacity of 3,600 tests a day through our Department of Health lab and Baptist new capacity, if the demand is not there, we're not going to be showing that every day. It doesn't mean we're going to have 3,600 tests every 24 hours. It means that's the capacity there, and of course, we have to, the demand will fluctuate some, just as you've seen over the last week.
Do you have a plan to get more people to come in?
You know, we develop that every month and part of our testing plan, and absolutely, whenever we see a breakout somewhere or a great need, we channel those resources there, and with the availability of our public health team across the state, it's easier to get that outreach, get those tests, bring them back here for division between Baptist Health and Department of Health for their work. Did you have anything else to add on that? Yeah.
So part of the reason why we have another platform is because of the issue of supply and demand. So Dr. Smith and the governor spoke about this issue, and the way to overcome that issue of supply and demand is that if, for example, there's not enough supply, those reagents for our PerkinElmer system, we had a backup system of the Thermo Fisher, and that's why we went to another platform. Our ability to partner with Baptist Health allows us to have the machine up and running at all times, so there's not a lag time in getting everything up and running. And it's, if you will, a pop-off valve for when we have extra specimens. We have in the past had to contract with other commercial laboratories to handle the large number of specimens that were coming through our laboratory. So now more of these will be able to stay in state. We'll be able to address these very quickly. And we are having partnerships now with the nursing homes in order to do a lot of their testing that has been recently mandated. So our volume will go up in the next few weeks.
Troy, you good, or do you have anything else to? No, all right.
In terms of increasing testing, are there any plans for just kind of like regular surveillance testing at either nursing homes or universities or K through 12 schools, places like that?
Dr. Romero, do you want to handle that, or Stephanie, if you have anything to add?
So the Nursing Home Association has mandated routine testing in nursing homes. So that will be going on. And again, that is one of the reasons why we need the increased capacity, because we're going to be doing that, a good chunk of that. So that repeat testing has been in place, has been put in place, and will go forward.
In terms of school settings, is there any plans?
We have no mandates at this time and have no plans to be doing regular testing at this moment. But this is certainly a consideration.
Of course, in the school setting, that's one of the reasons our antigen tests and equipment will be in our local public health offices so that we can support the need of our K through 12 schools. Is there any question remotely?
Yeah, Governor, this is Andrew with AP. The White House's coronavirus task force, the latest report has Arkansas at 6th in the country for new cases, 13th for test positivity. I want to ask you a couple questions on that report. I guess first of all, I just want to see if the latest numbers, how much of a concern are they for you at this point? And secondly, wanted to see if there are any of the recommendations that you're taking a look at, and not just the closing bars. I know you've talked about that before, but also recommendations that they've made dealing with college campuses, expanding testing capacity at campuses, and I think even surveillance of wastewater. Are any of those ideas things that you're considering?
And the answer is yes, and we take it very seriously in terms of their analysis, but also their recommendations. Some we have to reject out of various reasons, others that make sense here. In terms of my level of worry, if we would have had 5 successive days of 1,000 tests or 1,000 positives as we had last Friday, then I would be very concerned, and we'd probably be looking at additional steps that might need to be taken. Specifically, when it comes to the recommendations on the college campuses, we have expanded the testing there. We've sent teams up there to test, particularly where we had a spike in cases. In terms of the wastewater, Stephanie Williams can comment as needed on that, but we've actually implemented a pilot program for testing, surveillance testing in our wastewater plants. So that is an ongoing initiative that we are working in partnership with HHS, I guess. Yeah, with its CARES money, and the University of Arkansas is working in partnership with us. Other question? Yes.
The Arkansas Democrats are asking you to ask the Jefferson County Election Commissioner to resign. Have you seen this, and do you have a reaction to it?
I have not seen any details on that yet, or any justification for that. Obviously, the county election commissioners are selected at the county level, and so, by and large, we defer to their judgment on those type of issues. If I need to say anything about that, I'll look at that more carefully. Dr. Romero, did I answer that on the, was there anything more on that partnership on the wastewaters? No, sir. Did I cover that? All right.
I have a question, Governor.
Schools that have had to modify their operations?
Gina, there's two, and why don't you come give that report? The question was, whether any other schools had to modify their operations. So, Gina.
Good afternoon. Thank you, Governor. Yes, so far we've had 2 additional schools that have had to modify their response to on-site instruction. One is going to require about 40 students to quarantine who have been identified as close contact, and the other one had closer to 100 students. I'm sorry?
Which schools are those?
That was Pea Ridge Middle School, had about 40, and then some kindergarten classrooms in the Harrison School District.
Thank you, Gina. And then there was a question I heard remotely.
Yes, hi, Governor. This is Susanna with Ozarks at Large. Just wondering if you had any response to the latest headlines about Bob Woodward's book and the president saying that he was downplaying the virus very early on.
Is whose book are you referring to?
Bob Woodward. It's just kind of news that hit headlines about an hour ago. So
Yeah, I have no comment on that, but thank you for that.
Governor Hutchinson, this is Emma Claybrook with 4029 News. Are you concerned that the numbers of cases are low because people could not get tested on Labor Day weekend?
You're going to have to repeat. You're saying, am I concerned because people are not getting, being tested sufficiently at some of these events? Is that it?
No, I said, are you concerned that the new number of cases is low because people could not get tested on Labor Day weekend?
Oh, well, it's a very good question. And if you look at and that's what was unique about this last weekend, our testing remained high all through the weekend. And so I think it was 5,000 and 6,000 were some of the testing days, testing numbers, and our positives remained much lower than, of course, last Friday. And so I was actually encouraged by both the high testing numbers and the lower positivity rate in that testing. So I was encouraged by that. I think all through that weekend we've continued to see fairly robust testing. Did you have any other comment on that? So with that, thank you today, and hope you all have a good afternoon. Thank you.